Have you ever wondered what's normal back movement? I'm Shelley from ViMove Physiotherapy, and today I'm going to get Danny to walk you through what we call a ViMove assessment. So this is an assessment that we do on anybody with suspected back problems, or even if they don't have a back problems, as a screening tool to see how their back's moving. What the information it gives us is exactly your range of motion for your back, down to the tiniest degree, but also what your muscles are doing during these different movements. And that gives us a really good idea of how your back is moving, whether there's anything that we need to do to prevent any potential injuries in the future, and if you've got an injury or back pain, that we're on the right track, and if there's anything we need to add on to get you moving normally. Now, it's also very good at being able to show us your improvements over time once we've started implementing a program, and you can clearly see on the report how that's going. So stay tuned, keep watching. Now just be mindful, we've sped up the process in the actual assessment, so you'll see the different parts of the assessment, and then we'll pop a report up as well so you can have a look at that.
Sometimes the first move you do, they feel like they're going to come off really very, very good. Now, first thing I want you to do is nothing. So just stand there in a nice straight position. Just going to monitor the curvature of your lower back. Now, every time you move now, if you like bend forward, just get out of there, you'll see corresponding movement on this graph. So there's all the little monitors kind of. The green one is your EMG, that's your muscle activity, and the other ones are the other things. And all of these things we're going to do is going to build up a picture. There's a nice report at the end of it. Nearly everything is repeated 3 times to get an average. You have to do one good one, not bad one. The first one's flexion, so that's easy. So don't do it just yet, I'll just demonstrate. Hands on your thighs, just going to reach your fingers down to wherever you feel comfortable. When you get there, you're coming straight back. Don't need to stay down, you don't bounce your way down either, because you've got this really jerky on the machine. So nice, smooth, and go. Next one's extension, so that's going to be just leaning backwards like that, not your head, just your lower back, and then come back again. Don't hang around down there. When you can't go any further, you come back. Side flexion next. We'll start with the left side, so you're just going to keep your hands on your leg, slide it down to here wherever you get to, back up, trying to lean forward as you're doing it. So it's going to be 3 left and then 3 right afterwards. And this next one is the pelvis, trying to dissociate that from the back. So you're going to keep your body still, stick your bottom out, and then thrust it forward, like a pelvic thrust, and then back into that middle position that you've been in between. So bottom out, bottom forward, middle. Cool, okay, you're going to sit back down now. Try to sit sort of 3/4 back in the chair, and lean your back against the upright so you don't touch the pads in there. Sit in what you think is your normal sitting position, which is impossible when someone says that, I know, but how would you sit normally? And then you're going to hold that for 5 seconds long. Now I want you to actually slouch, so slouch. That's it. And now we'll just come really straight, so pull yourself up and hold. Good, now you know when we were standing, we were doing that thing with the pelvis back and forwards. We're going to do the same thing in sitting, so just slide forward a fraction. This time I always think it's easier to think about your tummy, so that won't be so confusing. You can bring your tummy forward, that's going to arch your back, and your tummy back, it's going to do the opposite, and back to the middle. That's what, stomach forward, stomach back, middle. Cool, we're done.
So if you found that really interesting, seeing how we assess backs on our ViMove machine, and you'd like to have us assess your back, give us a shout at Miami Physio or Lakelands Physiotherapy, and we'll be able to help you out.